There are many myths and facts about pregnancy that people may have heard or read about. Here are some of the most common ones, according to various sources. 1. Myth: the shape of your belly can predict the gender of your baby. 2. Fact: there is no scientific evidence to support this claim. The shape of your belly depends on many factors, such as your body type, the position of the baby, and the amount of amniotic fluid. 3. Myth: the heart rate of a fetus can predict the gender. 4. Fact: this is also not true. The heart rate of a fetus varies depending on its stage of development, activity level, and other factors. It does not indicate whether the baby is a boy or a girl. 5. Myth: a woman should eat for 2 when pregnant. 6. Fact: this is not necessary or healthy. A woman should eat a balanced and nutritious diet that meets her increased energy and nutrient needs, but she does not need to double her calorie intake. Overeating can lead to excessive weight gain, gestational diabetes, and other complications. 7. Myth: a woman should avoid exercising when pregnant. 8. Fact: this is false, unless there are medical reasons to do so. Moderate exercise can benefit both the mother and the baby, as it can improve blood circulation, reduce stress, prevent constipation, and prepare the body for labor. However, a woman should consult her doctor before starting or continuing any exercise program during pregnancy. 9. Myth: your skin will glow during pregnancy. 10. Fact: this may be true for some women, but not for all. The increased blood flow during pregnancy can make the skin more moisturized and nourished, which can give it a radiant appearance. However, some women may also experience acne, pigmentation, dryness, or other skin issues due to hormonal changes. These are just some examples of pregnancy myths and facts. If you have any questions or concerns about your pregnancy, you should always talk to your doctor or healthcare provider.